This episode of Speak Now, Hold Your Peace is brought to you in part by Green Sister Botanicals, plant-based hair and body care. Visit greensister.com for your hair and body care needs.
She's good. She's good.
Anytime there's a shooting, people are saying, we need more gun control law.
That's just human nature.
Welcome to Speak Now, Hold Your Peace, a live broadcast with real conversations about community social issues, politics, business, health, self-care, and more. We broadcast live on the Speak Now, Hold Your Peace Facebook group and the Speak Now, Hold Your Peace YouTube channel. And now, here's your host, Saywuddafeel Dre.
Welcome to Speak Now, Hold Your Peace. I'm Saywuddafeel Dre. Today I got a good show for you. I got four of my brothers here today, and we're going to talk about black men going to the doctor, why some black men don't go to the doctor. I think this is a good topic to talk about because I myself was one of those black men that don't go to the doctor. So I finally went, and I'm glad I did, and I'll get into all of that. I'll get into all of that, but I'm glad I did because I feel a lot better mentally. But let me introduce my panel first. Let me introduce George first. George, that's my brother, man. Been friends for a long time, and him and his wife always stay on me about me going to the doctor. Like, if there was something wrong, they'll ask me if I went. Just staying on me about being healthy and stuff like that. So I thought it was a given to have him on the show because he was part of me going to the doctor, and in addition to my wife. So I wanted to invite him on. So I got my man George. George, what's going on, brother?
I'm doing good, Dre. How are you tonight?
I'm good. So I want to introduce Dr. Guy Francis. Grew up with him, since we was 5? I guess since I was 5 when I moved out. Yeah, so I've been knowing him all my life pretty much. He's a doctor. He was my doctor when I was living in Jersey. He does his job very well, and he's like a walking medical book, and he knows what he's doing. So I was grateful to have him as a friend. I was grateful to have him as my doctor, and I'm definitely grateful for having him on the show. So, Guy, what's up, brother?
Hey, how you doing, Dre?
All right, doing all right. My next guest, my frat brother. Well, both of these next guests are my frat brothers. But David Fagan. We've been friends for a while too, man. Like, I don't know.
Well, almost 20 years.
Almost 20 years, yeah. And, he keeps me in line with everything. Health, behavior, stuff like that. So, it's my brother. Brother David Fagan, what's going on? Dr. David Fagan.
Hey, everybody. Glad to be here.
All right.
Hold on a second. I'm a doctor, but I'm not an MD.
Okay, yeah, and I'm gonna distinguish that too in a minute. And I got my other frat brother. My brother, man, went to college with him. The brother, let me tell you, when I met him, my first time hearing about him in college was that he could rap. He was rap. I don't know. You remember that time you battled Classic? Remember Classic from Philly? Y'all was just like, it was Philly versus Philly. I was like, no. But I met him, man. Like, that's been my brother from another mother, man, since then. Real good dude. He is certified in a lot of things. Well, you can see the name. You can see. And I brought him in because, in terms of going to the doctor, I thought about, we go to a doctor for our health, physical, how we feeling, but mental health also. So I thought it was good to bring that piece in also. So I had to invite him. I think he's going to be an asset to this show, just like everybody else. We got some power in here, man. So I want to go ahead and get started. What's going on, Frat?
Ain't nothing, man. Just chilling. Just chilling.
All right.
How you?
I'm good, man. I'm good. Y'all just don't believe. I can't. You know, look, I can't tell y'all how healthy I am. Like how healthy I feel. You know, it's a good thing, man. Very good thing. So, I got some questions. I want to start out. I want to start out with Guy, Dr. Francis. So that's Guy. We know Black men, you know, a lot of them, I'm not going to say all, a lot of them don't like going to the doctor. And there's a whole bunch of reasons, What do you think is the reason for that? One of the reasons, or the top two, because I know there's a lot, but what do you think is the top two?
I think the top two is probably one is socioeconomics, you know, of insurance, you know, unless they're getting it through their employer. And I think the second reason why we may not go to the doctors is for fear of getting bad news. You know, sometimes they haven't gone in such a long time. They think that when they do decide to actually go see a doctor, they're going to find something wrong with them, and I think that probably prohibits a lot of them from going. And probably the third thing is would probably be because they feel good. Nothing's wrong. You know, they don't have any symptoms of anything, and they feel good, so they don't feel a need to go.
Right. I honestly like those reasons that you just said was, and I'm gonna refer to myself sometime during this show, but a lot of times it was like I felt okay, so I didn't go either. Not knowing that, you know, some of the most craziest things could be going on in your body and you won't feel a thing. It could be anything. But I definitely think that's definitely some good reasons. George, I'm gonna ask you. And I know you, George goes to the doctor faithfully. There's no having to make him go. He goes. What motivates you, George, to go to the doctor and get your regular checkups and stuff like that?
Well, what motivated me most is my parents. My dad had high blood pressure. He ended up dying from a small, and my mom had diabetes. So I try to get to the doctors on a regular, even though if I'm gonna get some bad news. But like the doc said, that's one of the biggest reasons. A lot of guys fear bad news. Like especially where I work at. I work in a law enforcement area, and a lot of guys don't want to know. And when they do finally know, it's like prostate cancer. It's at its worst. Yeah. And if they had went to the doctors, they probably could have found out sooner. Changed their diet, did something different.
Right.
But yeah, to me is that like I want to see retirement. I'm like 17 months out. I want to see that. I want to enjoy it. I want to see my kids get married. Like things like that motivate me just to go.
Right. What about you, David?
Well, I mean, I think you and I talked about this. I'm a diabetic, and I was diagnosed at age 30. 30, 31. I'll be 50 next week. So here's the problem though, and I think Guy touched on it a little bit. Diabetes is not to treat it and manage it is expensive. But I work for the government, so we got pretty decent health insurance. So I go, every 3 months, get my A1C. I go to the eye doctor once a year. It's not a problem. But unfortunately, as you guys know, diabetes is something that afflicts a lot of African Americans. And if you don't have the good insurance, it can lead to a lot of the complications that will take you out of here way sooner than expected.
Right.
So there's that.
Damon, what's your motivation?
Like the brother, I'm a diabetic, so I make sure I keep myself go to the doctors, and here we gotta be done. Make sure my sugar levels, my A1C is good. partially my main motivation this year to make sure I keep my numbers down and stay active is so I can get life insurance. Because if your numbers ain't good, you can't get life insurance. And then you got to think of, as you older and you mature, you start thinking about what you want to leave for your children. Make sure that you insured, and you can't get insured if your numbers is out of whack. So it's very important to make sure you go to the doctors for more reasons than yourself. If you got children, to make sure that you can qualify for things for them.
Right, right. Yeah, I think you all presented some good reasons, and my reasons are all of what you said. I mean, every last one of them, just pretty much. I want to do it for my family. Like I know, like, and it sounds crazy, but if I was a single man, I don't think I would go to the doctor as much. And I hate to say that, but honestly, I'm just being honest. I don't think I would go as much. I would go, but I don't think I would go as much. So I'm glad that I do have a family. I have something to motivate me and something to motivate you guys to go. Let me just ask a quick question for you, Guy. So let me say this: in college, when I was working in the store, and somebody came in, he started reading some scriptures from the Bible, and we started talking. I wound up getting saved in the store while at work. Customers was coming in, and I was just sitting there praying, getting saved. And when I look back and I hear people, say you got saved in the store, and then the reaction and the response from me and other people is like, it doesn't matter where you get saved. The fact is you got saved, and that's all that counts. Right. So let's move it over to the doctor. There are a lot of black men, and I know a few that will go to the doctor, and their reason for going was because they don't want to get nagged by their significant other. They're pretty much not forced, for lack of a better word, forced to go, because whether it be for a job or just, their family telling them to go, they're forced to go. So when they get there, people say, well, it doesn't matter how you got to the doctor. The fact that you got there is all that counts. I beg to differ with it a little bit, because if somebody's there, and I'm going to ask you, Guy, if you experienced this, if somebody's there by the will of someone else, or being forced to there, or just didn't want to be nagged, oh, I'm here. Yeah. Do you think, Guy, that affects the treatment or getting information from them that is like more accurate? Like, will they just not participate, or just give you barely enough information to tell you what's going on with them? Do you think that affects the treatment and the services?
No, I think that there's two things. If they come with their spouse or their significant other, they're more likely to tell the truth when you ask certain questions. The spouse will either even offer some of the answers for them because, for fear of them not answering correctly or truthfully, should I say. But, sometimes, if the patient is only there because they've been told to come or go to the doctors, maybe once in a while you might find someone who's not really interested in any kind of treatment if something is found. In the case of, say, high blood pressure, if they come in and you find that they have a significant elevation in their blood pressure, then, they may not want to, say, try medications or any other type of treatment that you might want to start. So I think after coming to see you a few more times, and they get to trust you and start listening to what you're telling them, then they're more likely open to accept treatment of some sort,
Mm-hmm.
But for the most part, no. It all depends. It depends on the person, really, and if they come alone or if they come with their significant other.
Okay. I know you mentioned trust. So as far as trust, I read about a California study. I forgot the amount of black men. I forgot the sample size. But there was a study that showed the results showed that black men don't trust doctors that trust white doctors and Asian doctors. They felt that well, I forgot the exact words. They felt that They basically they couldn't trust a white doctor or an Asian doctor and didn't feel comfortable with it. That was one of the things that was mentioned, that they didn't feel comfortable with a white or Asian doctor. If given, do you think, do any of you guys think that's a valid reason, David?
Well, actually, in preparation, I actually looked up a couple of things, and you're 100% right. Some of the reasons given was lack of trust, but that was rooted in the historical significance of what happened in Tuskegee, and a lot of misinformation about that. Like the average black person seems to think that the government actually gave black men syphilis, when in actuality it was just them leaving them untreated, and they wanted to see the effects of untreated syphilis. But to kind of touch on what you just said, though, there is a lack of diversity among physicians. So Brother Guy is a rarity, and I'm sure you don't need him to tell you that. But there's not a lot of black doctors out there, so you go looking for somebody that looks like us. But the major thing, though, and I think Dr. Francis can probably expand on it. Every year when they do entry studies for folks who come into med school, and they basically do kind of like a quiz on perceptions. White medical students and Asian medical students always seem to think that people of African descent, black people, have higher pain thresholds. We require less, pain management. And I can tell you this, and the problem is it leads towards a lot of things going untreated because they feel that we can handle it. I can't say this before I wrap it up, though. I had a white physician. He was a doctor's assistant, very thorough, younger guy, 35 years old, really knew his stuff. He found a mole on my back, and when he was going to get a biopsy, he froze the area and he chip it off. He makes this remark that I have very thick skin, and he hadn't seen anybody with skin as thick as mine. And I could tell you, and I told you about this before when we met Dre, that no one has ever accused me of having a thick skin. So, but it's that perception, whatever was going through his head, that wow, this is a black guy, so I'm built different.
Interesting. Wow. I don't know if y'all remember Jimmy the Greek. He's in sports. He said black people had stronger legs. Lost his job. Haven't heard from him since. So that's crazy that you say that. Let me ask y'all this. Trying to think of the question. It was a question that came across my mind. Do any of you think that only a black doctor knows what a black man needs in terms of medical issues and examinations? Like, do you feel, I've heard black men say, only a black man would understand me. And that was their response to going to the doctor. So I'm thinking maybe they were talking about just talking as a black man, but they were talking about going to the doctor. So they're saying, basically they were saying, well, only a black man can understand. I guess they meant the human body, the black man's body, I guess, because of, certain things we're at risk of. Do any of you agree with that or partially agree with it?
Well, I'll tell you that in my practice as a therapist, my practice has morphed into, I'm a full medical home now, so I'm no longer just a therapist. I have a medical home and I hire nurse practitioners and different things like that. And I will tell you, in the community, we've seen a surge of people coming in because of the cultural relationship. I think that what we find in my practice and in my field, along with the medical services, is that people feel more comfortable talking with people of their culture. Whether it's a male or a female, I think the relatability from a cultural aspect is something that's definitely attractive to African Americans. So, it's my hopes that as I continue to bring more therapists in, I hope that, the other brothers on here that's doctors, we are encouraging young black men to look at this and show them that it's a reality they can do it, because culturally, I think that connection is important. And it's just the community is coming to my office more because we have black nurse practitioners that's there to service them.
Mm-hmm. Makes sense. So let me ask this. guy, Dr. Francis, let me just ask you this. Can you explain? I'm gonna ask you to explain. Can you explain how important it is to see a doctor, even if nothing's wrong with you, because of just for the sake of early detection of something? Can you explain how important it is to get regular physicals and checkups?
Well, I always tell my patients that a physical is really like a screening tool. It allows you to come in, have access to the medical um, healthcare. I mean, that might be your only point in the healthcare system, and that most physicals that we do on individuals are pretty much a snapshot of what they are at that particular time. And you can do a physical on somebody today, and tomorrow they can have a heart attack, but yet they came in, for a physical, and they say, well, how can that happen? I just had a physical. Well, like I said, a physical is just a snapshot of what you are today. It's the same thing for those that are diabetics on the panel. When you do a finger stick, you're checking your blood glucose. That is what it is right now. But you go home, you eat dinner, you check it 4 hours later, and it's different. And so, one of the things that we use for you guys is A1C, is to see what your blood sugars have been over the last 3 months, what the average is. So that gives you more like a video versus just taking a picture of it. So when we talk about physicals and when you come in, I just think you just, what the other brother said, I think George said, like, um, he started to go to see the doctor more frequently, or go, because he was brought up that way. He got used, I guess, accustomed to that's what his family did. His dad did for him. Got him used to going to see the doctor. Same thing as going to see a dentist or any other healthcare worker. It's basically just getting individuals accustomed to going and being seen, because you might come and see me, and you may be seeing me for let's say a physical, but then I find that you have you have high blood pressure, or you have your we do some blood work and we find out that you're diabetic, and you didn't know that you were diabetic, or they found a mole on your skin that looks kind of like suspicious for cancer. So it's a way to you might find something that you weren't looking for when you do go, but most of the time when you do go to the doctors for physical, at least it's you find nothing. You're pretty much healthy, for the most part.
Right, right. Um, how dangerous, for lack of a better word, but how dangerous is it to lie about your health at a doctor's visit? Because some people do it. Some people don't. They just don't tell the truth because they don't want to hear what you're going to have to say, or they may be scared that you want to run more tests. How dangerous is that to lie to a doctor?
Well, I just think you're probably just cheating yourself, pretty much. Um, I guess if the patients start to trust you, thinking that you're looking out for their best, I, I think that they will more likely be honest with you and tell you. Example, like if I let's say that um, person comes and sees me for diabetes, and this happens a lot. They're not really honest about what their numbers are, and they say that they're doing a good job on how they're eating, exercising, and then you do an A1C, and it just doesn't match up to what they're telling you. And so most of the time, doctors, if they don't really dig deep and ask, are you taking your medicine consistently? Are you skipping any dosages? Are you exercising, as much as they say they are? If you're not digging deep into that individual, they just won't tell you. And so what you wind up doing as a doctor is increasing their medication, or adding another medication, which you don't need. So here they are, they have a higher dose of medication, or they have now two medications, three medications, and they really didn't need any of that. All they needed to do was really just be honest with you and say, hey, doc. And some of them do say, hey,
Mm-hmm.
doc, I'm gonna be honest with you, I wasn't taking it. and that makes sense. So I when I do the test or I draw the blood or whatever, and the blood work comes back and it's elevated, I can really make a good decision on what our next step should be. And so I think it comes in with trust and being open and honest. But like you said, if you're not going to be honest and truthful when you come to the doctor's office, you're going to end up in the long run hurting yourself anyway.
Right, right. For
And,
me,
and let me jump in for a second because I just had an experience that was really discouraging, right? So for the last year, my A1C has been at 6.0. So I got a little depressed, and when I get depressed a little bit around the holidays times, I start eating a little bit differently than I should. Long story short, the last time I got my A1C, it jumped to a 7.3, which is a little higher. So the doctor suggested her nurse called me and suggested that they add another medication. And I said, no, I know that I'm having some bad eating habits and I just need to do some behavioral changes. The response I got back from the medical professionals was that it's going to be very hard to do that and you need to take this medication. And that crushed me because my
wow.
motivation was to make some behavioral changes on my own. And to get that intel so discouraging. So I also think the way that doctors present information to the consumer can motivate them to continue to come or can demotivate them to come. So I think that whole rapport building process and making them feel comfortable, regardless of what the race is very important. It's very important that people feel comfortable with the doctors and follow the lead. Because this is somebody that's telling you how to eat and how to do different things like that.
Yeah, let me, David, I'm going to get to your question in just a second because I got a question for George and I got another question for Damon, but I'm going to let David ask this question after I ask this quick question for Guy. I know that sounded like crazy, didn't it? But I know what I'm doing. Guy, let me ask you this real quick because then I'm gonna let Dave say what he want to say, and then I got a question for George and Damien. Guy, the A1C, mine was 6.02. Mine was 6 also, right? If you eat right and do what you got to do, how long? What's the earliest you can check to see for improvement?
Usually 2 months, but we usually do on average 3 months to see. I had a patient come in. He came in with A1C of 6.7 for the first time, and technically, if your A1C is 6.5 and above, you're diabetic. If your A1C is 5.7 to 6.4, they call that a pre-diabetes. So normal folks should have A1C less than. This young man came in, and I guess he was really unhappy about it. Most of the time, some doctors just go ahead and just give them metformin or give them some medication, a pill to take to try to help the diabetes. But I just gave him some. Listen, I didn't. I just gave him some time to go ahead and work on losing some weight, exercising. And next time he came in, his A1C had dropped down to 6.0. It was still pre-diabetic range, but I gave him a chance, and that's what you have to do. You can't really knock people over the head. You got to try to encourage them in some way, and really just tell them that, in the long run, these are the complications that you're facing. So, and I agree with the last person. Is it Damon? I think last time we spoke. I'm not sure. Yeah, I agree with him. You can build them up or you can tear them down, and I allow them to make a decision for themselves along with me together as a partner, to
Right.
make the best decisions for them. So.
Right, and he had a 6.7. You said
he had a 6.7, and he ended up losing about 5 to 10 pounds. He started exercising. He came back, and I checked his A1C. It dropped down to 6.
Okay,
so
well that's
he was
motivational.
He was back out of the diabetic range.
That's motivational. That's motivational because I'm gonna tell you, mine. I just got mine checked. It was 6.0, and I lost 18 pounds. So.
Good.
And I walk every day, and my blood pressure is down. I think my blood pressure is down from the walking. It's down. It's like that bottom number is 70, 72, when it used to just stay at 89, 90. So, but that's good to know. It's very motivational because that's one of the main things that I want to eat right and I want to lose weight and just to get that number down. But David, I know you was going to say something. You can go ahead. I'm sorry about that.
Yeah, just real quick, something that Damon said, touching on it from the organization, the industry point of view. So there's a movie on, I think it's Hulu or Netflix. I think it's Netflix called Dope Sick. and it's basically talking about the
Yes.
OxyContin craze of the early 2000s, and essentially it's talking about how the big pharma pushed OxyContin. One particular company pushed it into the doctors, and they basically literally bribed the doctors to prescribe OxyContin as a primary pain management. And I had friends. As you know, my wife, she did pharmaceutical market research for 15 years, and I knew some other folks that were in sales. And we have to be very careful about what these doctors are pushing on us, especially, like Dr. Francis said, as soon as you come in slightly diabetic, the first thing they do is throwing metformin down you. And that's fine, but we never know what the motivations are, because maybe some sales rep that came in and said, yeah, Synjardy or Trulicity or Ozempic or something. This is the latest and greatest, and the next thing you know, they're pushing it on us, and it may not be the best thing that we need at that time. So so food for thought.
Right. That's a good point too. George, let me ask you this: when you go to the doctor and you take these tests, and this question is kind of related to the question I'm going to ask you, Damon. But George, when you go to the doctor and get your test, and you waiting for the results, is there any thought of is there any anxiety or any thoughts of like worry or anything like that when you wait for your results?
Well, I guess it depends on what test you're taking too.
Mm-hmm.
I mean, I also have some type 2. So if I'm waiting for my blood work to come back from that, if I know I ate properly, or sometimes you cheat here and there, I'm not really worried about it, because you can adjust your diet down. But if it's something like recently, I took a EKG, I did an ultrasound, and I'm still waiting for ultrasound. The EKG came back well. I did a stress test. You're always aware about those, because to me, I mean, if your heart ain't working, you're done. I mean, diabetes can affect those too. But when you go, straight up, just straight up, and those are not working, absolutely. I think you have a little anxiety waiting for those tests to come back. Absolutely.
Okay. And like I said, the next question is related to this. Damon, do you how can I put this? I just want to ask it the right way. How much do you see clients, or how much does the anxiety of waiting for tests play a role in your field of work? Do you ever have clients who suffer from anxiety from just stuff like going to the doctor or finding out things from the doctor, or they found out things from the doctor and they now need mental health services for? Have you ever experienced that?
Well, at my office now, because we have the nurse practitioners there and they look like us, I think that there's a different level of comfortability. So I don't really have people in having sessions and talking about anxieties related to some type of medical test. That's just routinely don't really happen. But I'll tell you for myself, one of the biggest fears, anxieties, and it drives me crazy. And I'll be honest with you, the HIV test. You have bad sexual practices as a young man. You do these things. You think it's a death sentence. And I happen to have an Asian doctor, and she just explained to me what technology has done, how it advanced, how there's so many things. And she just made me feel really, really comfortable, because I had avoided taking that test for such a long time, because the results of that test would take away my mental peace, because of course you don't want to face that. So it was a test that I was the scaredest of. So yeah, anxieties can be very high, but luckily everything turned out good. But I think it was the education and the assurance that you had bad practices, this could be a reality, but these are the things we can do that can help you. I think the way that the practitioner presents options and different things can go to lessen those anxieties.
Right.
But it's not something that's commonly in therapy session when somebody say, I'm scared.
Okay. So here's my thing. The anxiety for those who men who don't go to the doctor because they, you have some type of fear of the results or what you're going to find out. The anxiety, if there's something wrong with you or you think something's wrong with you, if you don't go to the doctor, the anxiety is going to it's going to make it a lot worse. And I'm going to give you a quick example. There's times where, you know, something's wrong. I feel like something's wrong with me. And I used to feel like, you know, like if I go to the doctor, the anxiety was kicking in and all this other stuff started hurting or causing me trouble. And it wasn't that there was something wrong. It was the anxiety affecting every part of my body. I had the anxiety before I went to the doctor, my recent visit. The anxiety, I didn't know what was going on with me. I had pains in the stomach. I had pains from one side, then on the other day, and then some other pain the next. And my arm would pulsate. And then and when I go to sleep, if I laid on my right side, the pulsing would be on my right side. Sometimes my leg, sometimes my right arm, sometimes my rib. Turn to the left, then the pulsating goes to this side. And then during the day, my eyes pulsating, my leg, my stomach, all types of stuff. And all of that went away once I got the results of my tests.
Yeah.
Crazy, right? Like the anxiety will get you so I think, you know, for all of those who, you know, you go to the doctor and you think something's wrong, then you start thinking something else is wrong. It could be anxiety. And you know, you got to see somebody about that, talk to somebody, because when you hold that stuff in, I was holding it in. I don't know why, but you know, just holding it in, I guess. And it really affected me. Like it was terrible. Like most of the stuff I don't even experience it now that I got test results. I know I'm okay, especially the stuff with the heart, the stress test and all of that stuff. And, you know, and Guy will tell you, I would call a guy like Dr. Francis, I would call him and be like, this is the results of the doctor. This is what the doctor told me. And it's crazy because he said something different from what the other doctor said. I mean, it wasn't totally different, but like you said, I think in some cases, and the doctor I have is pretty good. In some cases, some doctors err on the side of caution, they're extra cautious, and then there's the doctors that say, hey, you can lose this weight and get this down doing it the natural way. But you know, I give my results to Guy, let him look at it, you know, and you know, sometimes I be getting a little nervous, but I can't tell you how many times that he eased my anxiety. So for those who, you know, we got anxiety, speak to somebody about it. Speak to one of your brothers. Speak to somebody, but just don't hold it in. All right. I got a question, and this is for everybody. You know, anybody can jump in. I forgot what study it was, but it said, not a study. It was some type of statistics. 2 out of 5 blacks have high blood pressure that starts at a younger age than other populations, the rest of the population. Do you think high blood pressure is more hereditary from family members, or do you think it's the everyday stressors that a black man faces in this world today? Brother Fagan, go ahead. You shaking that head? I know. Go ahead, brother.
I'll say this much, and Dr. Francis could come in. I'm sure he will. It is going to be diet most of the time. But here's the funny part about diet: if your diet is crap, it's because your parents are feeding you crap, because their parents fed them crap, because their parents fed them crap, and it goes all the way back to slavery. So here's the thing: is it hereditary? Is it diet? At the end of the day, does it matter? Because even if you have a predisposition for high blood pressure, if you have a healthy diet, if you're eating vegetables and low fats and things like that, it's not going to manifest and be a problem. So, you know, I think now you're right. Stress is added to it, and Lord knows, as black men, you know, as we get into our car each day and drive to work, we wonder if this is going to be the last. You know, if we get pulled over by the wrong cop. But you know, we can't put it all on stress. We can make more of a we can have an effect on this more than we say we can.
Right. Yeah. Guy, what do you think?
Yeah. Let me just say that 90% of blood pressure issues or high blood pressure is we just don't have a reason. We don't know. We call it essential, or they used to call it idiopathic, meaning that there's not a known cause. And then you have like around 10%. There are things that are actually causing it. You can find out what those things are. And so um, it doesn't mean that I'm gonna go back to Dave. It doesn't mean that diet is not part of the problem. And, when you talk about we ate crap, our parents ate crap, their parents ate crap, but majority of it we just don't know what causes it, basically. And so by definition, high blood pressure is having right now the latest definition of high blood pressure is having a systolic blood pressure, I mean top number above 120, and the bottom number is above 80. When it's that's stage one. Stage two would be a blood pressure greater than 140 on top, greater than 90 on the bottom. So that's that's the criteria we use to diagnose high blood pressure. But you got to have that reading done on 3 different occasions. It should be done on 3 different occasions. It should be 3 different settings. It could be in the same setting as a doctor's office, but it should not be in the same day. And the other thing that you need is for you to sit or rest for about 10 to 15 minutes before you take it. I mean, you could have just ran into the office because you were late running upstairs or whatever, and your pressure is going to be high. But if you wait about 15 minutes, it'll come down to where your resting blood pressure is. And so going talking about the 10% causes, because I can't really talk about the 90% because we just don't know. But the 10% causes are things like it can be diet, it can be or a lifestyle. So it can be the alcohol we take, the nicotine we're getting through smoking. It could be caffeine. It could be stress. It can be illicit drug use like cocaine and amphetamines. Those are things. It can be diet high in salt and low in potassium. It could be those things, and it could be you being overweight, you're not exercising. All those things contribute to having an elevated blood pressure. But if you change a lot of those things, you can actually get your blood pressure down. So weight loss, diet low in salt, quitting smoking. Someone was saying something?
I was going to ask you. I'm sorry. It almost jumped out. As MD, you can
Okay.
help clarify this, and maybe somebody else. Sometimes, especially when we talk about diabetics, if you talk to your family or you talk to other people, you talk to this education, they'll say that number is for that culture, and our number should be different. You know what I mean? Like, if you say it's a 6.0, that's for white people. Their number is like an acceptable number for African American versus another number for different cultures. You don't have to get that though because that's white people. If you're black, it's okay to be a 7.0. It's a lot of misconceptions.
Yeah, that's a good thought. Is there I'm guessing there's no standard for certain cultures, right?
Much for the diabetes. I mean, listen, we listen. Standard of care is something that we have to go by because that's our protection, so to speak. So when we talk about less than 7, we're talking about the ADA, the American Diabetic Association, what they recommend as being controlled. But there are some. I'll give you an example. There's some criteria. Say, for example, when we're looking actually at lab values. So, African Americans, we tend to have a low white blood cell count. For example, our blood cell count could be like a white blood cell count of 2.2, and then they're ready to send you to a hematologist, or a blood specialist doctor for having a low blood cell count, a low white blood cell count. But the reality of it is that when you look at the reference ranges that you see on your labs, most of those are done, if not all of them, are done on Caucasians. And only till recently that we've had, like, if you see if any of your recent blood work, you might see something called GFR, or estimated GFR. That's basically you can see that they have those for everyone else, and then they have for African Americans. So sometimes, yeah, some values may not be as important. It's usually standard for everybody, but then there are some values that, in this case, of say white blood cell count or estimated GFR, those things are specific to African Americans. So if you came to my office with a white blood cell count of 2.8, I would tell you you're fine.
One thing before we continue, I'm going to stop this live video and record it, and then you will and I'll put it together and post it because it keeps logging off. So I'm going to stop it. I'm going to keep going now, but if it stops, I'll just record it and then we'll put it together and everybody will see it. So if you're viewing it, you'll see all of it. All right. So I had a bad connection, everybody. I do apologize for the interruption of the show. I'll try to do my best to edit all the video and stuff and give you the whole thing. Dr. Cromwell, I'm waiting for him to log back on. When he comes back in, we can go ahead. Well, I'll start, but if he logs back in, I'll bring him in. But what I was saying before we got interrupted and disconnected, there was a study, Dr. Derek, I think it was Dr. Griffin, who there was 14 groups of men who they were trying to figure out, they were doing a study on why they don't go to the doctor. And the top two answers that they got was that one was that something about they wouldn't be able to do their normal activities anymore, changing their activities. It would change, and it's something that they weren't willing to do. And the second one was, I think, was a pretty good one. They said that the doctor, certain doctors that they went to got on them about what they were not doing, as opposed to what black men wanted to hear. Want to be asked why they don't do it. So I guess they wanted the doctors to say, kind of go more into why they don't do it, as opposed to getting on them about not doing it. So let me bring Dr. Francis back in. All right, just a second here. All right. Can you hear me, Guy?
Yeah, I can hear you.
All right. So I was saying before that these men, they wanted the doctors to not so much get on them about what they don't do, but just at least find out the reason why they're not doing it. And that's one thing that I like about my ideal doctor, like you, Guy, and the doctor that I have now. They ask a lot of questions. If your kid comes home and you say, how's school? All they're going to say is, it was all right. It was good. And that's all you're getting out of them. If you don't be like, well, do you have homework? Do you have this? Do you have that? What you learn here? They ain't telling you. So I think it's important for the doctors to ask questions, because a lot of people ain't going to go in and give you every little bit of information about the doctor, about their health, or what they're not doing and what they're supposed to be doing. So, Guy, do you think that's a good characteristic of a doctor, just to ask more questions about why they don't do it, as opposed to getting on them about not doing it?
Yeah, I think that's it's just very important, because you really learn why an individual may not want to adhere to, say, medication, or why they didn't go see the specialist that you recommended, or why didn't they go and get the test that you ordered. You really find out, and I mean, the thing is that you want to be able to develop some kind of rapport with your patients, because I think when you develop a good rapport with them, they learn to trust you, and they actually start to speak openly and honest with you. But again, I mean, you got to be forceful in some respect, because it's a liability on us as doctors if we're doing things for the patient and the patient is not being compliant. Sometimes, I hate that word compliant, because
yeah,
I can't stand that word, but when the patient is not compliant to what you're offering, it's sometimes it could be a waste of both your time and the patient's time, but also it could be a liability to you in terms of malpractice.
Yeah.
So some doctors will some doctors will say, listen, I can't continue to treat you because you're not doing anything, that I'm recommending, So
Right, right. George, when you go to the doctor, um, I'm not sure if you ever got any. Of course, you got some news that you didn't want to. You probably had some stuff about the doctor. You heard some doctors say, you need to work on this and work on that. How do you prefer the doctor to explain that? Like, what's the process that you like to see if it's something bad?
If it's something bad,
Because some doctors they just come in and they just lay it on you. Boom, this is it. Bam. Like, and they don't care.
I think it depends on the person. Like, I could take the news straight. I'd rather you give it to me straight than you beat around the bush. Let's see if we could do this, and we could do. If you know what it is, and there's no other option for me, other than the option that is going to work or not going to work, I want you to tell me.
Right.
Because you beating around the bush is not helping that person.
Right.
And like the doctor said, you got to have that trust. Because I had a doctor, the first doctor I went to, when I first diagnosed with diabetes, test and everything, he wanted to give me the dye, whatever. I said, no, doc, I can get on the treadmill. I said, I used to be an athlete. I might not look like it now. So I get on the treadmill, do the whole thing, come back for the results. He goes, well, I want you to take a beta blocker. I said, why? Is there something wrong with my heart? No, there's nothing wrong with your heart. It just goes along with diabetes. Well, hold on. That's what case study says. But is there? So I refuse that beta blocker to this day. So I take my diabetic medicine, but I don't take the beta blocker. If there's nothing wrong with my heart, why would I be taking a pill? He couldn't explain that to me, and I trust thing comes along.
Right.
But yeah, I take it straightforward. I think it depends on the individual.
Real quick, hold up, David. I'll get to you right after this. Guy, how do you is there a certain way you prepare yourself to tell somebody, like if it's bad news, like if it's cancer, diabetes, or like some type of heart disease? Is there a certain way that you prep to tell them that, or is it depends on the person?
I think it depends on the person, but that's always a hard discussion to have with the patient. But you have to be honest with them, and I mean, you got to find a way to say what it really is. If it's cancer, or if it's say blockage in the heart from a test that we need to do some other procedure, maybe send you to a specialist to consider maybe open heart surgery or something like that. You got to be open and honest with them. I mean, it's a hard thing to do, but you have to.
Right. David, you had a question?
I don't know what you do. No, I'm saying I don't know what you do to really prepare yourself, other than to be consoling to them if they should have I won't say a meltdown, but a moment.
Okay. Right. David, you had a question?
Yeah, I'll just say this much. I think it does matter though how it's introduced, because I mean I was like 30 years old, and it was like they took my fasting one year, and it was like 140, right? And doctor was like, okay, cut down on the sweets. I'm 30 years old. I was going to me and my she wasn't my wife then, but she was my fiance, girlfriend, whatever. We're going to the gym 3 times a week. I'm eating anything and whatever that comes across my plate, because that's how you get down when you're 30 years old. I come back the next year, my fasting was 196. He's like, literally, he's like, okay, I'm gonna send a nurse in. So the nurse comes in, and then she's like, okay, she walks me out to the hallway. She's like, yeah, you're a diabetic. There's some pamphlets that we have for you at the front desk.
Wow.
That's it. I mean, this is like 2002, fall of 2002. I don't know what that means. I mean, I'm going to die. I mean, and then, so the point being is that diabetes is also a disease that, if you make a big stink about it early, right when you get those slightly elevated levels, you can stave it off. But I don't think that it's taken seriously enough. And just in closing about what George said, yeah, my doctor did the same thing. I mean, I had elevated A1Cs, but my blood pressure, everything else was normal. Actually, what's the one, the cholesterol, both my numbers were under 200, and but he gave me the lisinopril and the cholesterol anyway, and I didn't take it for years
Right.
because I'm like, well, my numbers are fine. Now at 50, yeah, I'm taking it as a preventive measure, but I wonder that reason that they say, well, diabetes is, if you get diabetes, you're gonna get high blood pressure and cholesterol, so we're gonna give you this first. That's not a one size fit all approach.
Right,
And,
right.
I mean, maybe a guy can step in, but it just seems like it's adding more medication that's unnecessary, at least early on.
Right.
Right,
Right.
right.
I think the first thing you need to do really is to, if they found that you're diabetic, you need to just monitor the blood pressure, to see if it's going up. If it's good, it doesn't make any sense to put you on a blood pressure medicine. Now, I know sometimes they'll put you on, they call it ACE inhibitors, and that's supposed to protect your kidneys from proteinuria, meaning you're losing protein in your kidneys, in your urine. You're losing protein in your urine by your kidneys from diabetes. And so, sometimes they will put you on like either an ACE inhibitor, or an ARB. That's the other class of medication we use. So, and that's just to protect your kidneys. So I've seen them. I see people, physicians do that, but then they do the knee jerk reaction. They put you on cholesterol medication as well. First, find out whether they they have elevated cholesterol or triglyceride levels. That's what I do. I'll give you an example. My dad, he's diabetic and he has high blood pressure. And he's my patient. I treat my own father. I've never put him on a statin, which is a cholesterol medication. I never put it on him because his cholesterol was like, total cholesterol was like 120. Why would I want to put him on
Hmm.
um, a cholesterol medication, and his bad cholesterol is only 70?
Right.
So I mean, it doesn't fit all, and
Yeah.
so you have to take those things into account.
And it's ironic that you say that because when I went to the doctor, I called you and I was like, she gave me a cholesterol. It's for the bad cholesterol, but overall the number was good. You was like, don't take that, Dre. So I didn't take it. She gave me a prescription, but I didn't take it. So it's ironic that we talk about that. It actually happened. So, but I'm gonna wrap it up, man. I'm gonna wrap it up now. I just want to all of you just give your last thoughts, just your final thoughts, and then we're gonna wrap it up. I'll start with you, David.
Yeah, I mean, it's just that I think also, once again, from an organization point of view, the healthcare industry, or at least National Institute of Health, or the medical arm of the government, black males as a rule, I think, have been left behind. I'm pretty sure I could say as a black community, because as you know, black women complain also about getting substandard treatment, but they need to target black men. We have our own set of issues, health issues now, that is not really being answered. And I think, to kind of go back to what you said earlier, Dre, about, can only a black man be treated by a black doctor? Well, no, any doctor can treat a black man, but I think the doctor needs to be prepped and educated on the needs that we have and the stressors that we have. And I don't think they're really taking the time. And until that happens, I think we're going to just continue to see this bad decline of black men just, taking their chances with whatever. I mean, especially now with the advent of the internet and so much false information and homeopathic and these alternative remedies, aka Aaron Rodgers. That's another discussion. But until we start getting the attention that we deserve, it's going to be problems.
Yeah, yeah. George.
Well, I'm gonna come from perspective. I think us as brothers, we need to push each other. Like sometimes I push Dre, he'll call me, but we got to push each other. Family, brothers, friends that we know, just say, hey, you going to the doctor, you checking up on yourself, because you go through a lifetime and you work a whole job, and at the end of that job, you dying of prostate cancer or some other disease because you just didn't want to go to the doctor. And you do have the medical insurance. I understand some of us, we can't afford it. We don't have the medical insurance because, economic status. Some of us can't get to the hospital. We have to, but we need to push each other and do our small parts in that area. And I
Right.
think that will help get us to the doctors more.
Right. Guy, final thoughts?
Yeah, I would just say that I was encouraged, our brothers and sisters to continue to go to the doctors on a regular basis. I know that we spoke and we talked about, going to an Asian doctor or Indian doctor. I think in I've seen in the early 90s that a lot of our people sometimes thought that the Asian doctors or the Indian doctors were the smart doctors. And
Hmm.
now I see a difference. I see now more coming to me saying that I sought you out. I was looking for a black doctor because I just feel more comfortable. I think you guys have my best interest. And so, um, I I've had some patients that came in and they were on diabetic medications and they were on high blood pressure medications and they didn't have diabetes, nor did they have high blood pressure.
Hmm.
So, that has happened as well, and I can't say why the other doctors put them on it. But the main thing is to encourage one another to try to keep us getting checked out, on a regular basis. Just it's a good habit of doing that would be good. The last thing I want to say is that besides diabetes that we talked about and high blood pressure, um, there's other diseases that we need to look out for. So, and for our African American sisters would be breast cancer. We need to stay on top of that. For our men, we need prostate checks. 'Cause sometimes that's taboo to do prostate exams. Sometimes they don't want to do it, just because of that. But that's something that they could have in their early 40s, and if they don't go get checked, they wait till they're 50 or 56 or 60, and the prostate cancer has had a long time to do its damage. And the last thing is colon cancer. The screening for colon cancer for African American is men, well, just for people in general now, is down to 45. It's no longer 50. Same thing with prostate cancer is we screen at 45, but I screen my African American population at 40 because
Hmm.
you can see us having it sometimes at 42, 43. So it can come early. And so I just try to encourage everybody to just find a doctor that you can relate to, that you can trust. If they happen to be African American, so be it. If they're not, just ask questions and don't just accept anything. If you don't like what you're hearing, go see someone else and get a second opinion or find another doctor that you feel comfortable with. And so that's all I can like to add for that. But for you
Thank you.
two brothers that's still here on here has diabetes. Diabetes it's worse than high blood pressure, I want to say. And so I hope that you guys are working very hard to keep those numbers down because it causes so much damage to whether it's your small vessels in your body, whether it's stroke, heart attacks, kidney damage, for renal failure we call, and the last thing is small vessel disease in your extremities, so toes, hands, whatever. Just you guys just try to get that number down and be tight with your A1C levels. You know,
Thank you, brother.
and
Thank you.
I just encourage you guys.
Appreciate
You
it.
know,
Thank you. So I want to say this for my final thought. Black man, go to the doctor. You're gonna like if you don't, you it the regrets of that you're gonna have if something happens or if you're diagnosed with something and you could have avoided it. It's gonna hurt you more than the act. It's gonna hurt you mentally. Prior to going to the doctor, I've never said this before. I never even told Vernell. Just came to my head. Prior to going to the doctor, I was kind of scared of not of hearing something I didn't want to hear. But then I had a dream. Everybody was at my funeral, and my kids walked up to my coffin. I mean, and Vernell was over them. She was hugging them, and Maya, I think it was Kayla who said, "Mommy, all he had to do was go to the doctor. They could have saved him." Woke up, and that's what made me make the appointment because that's deep, man. Like, can you imagine just having a dream that they're at your funeral and your daughter is like, "Daddy, Mommy, all he had to do was go to the doctor." And the reality is, it could have happened. I'm glad I did go because if I didn't and something's wrong with me, even if I'm living, if I didn't die, but I'm in like a certain stage of cancer, which, the later the stage, the worse. it's better to detect it early and prolong life than to not know about it at all and find out when you're in stage 4, whatever it may be. So black men, go to the doctor. The amount of fear that you have going to the doctor is nowhere near the bad feeling you'll have of what your family is thinking that you could have saved your life or prolonged it for a longer time. So go to the doctor. Make sure you get to the doctor. Nothing can be worse than avoiding something that you could have resolved if you went. All right. So that's going to be it for me. Thank everybody. I thank you all for tuning in. I appreciate you watching this episode. Stay healthy and stay safe. Thank you. We out. Peace.
Thank you for watching the Speak Now Hold Your Peace live broadcast. Be sure to subscribe to us on YouTube and join us on the Speak Now Hold Your Peace Facebook group.